Well, Hoosier medical leaders say demand for behavioral health and addiction treatment services is at an unprecedented level, but providers have really been unable to keep pace. Business of Health reporter Kylie Valletta tells us how a new hospital hopes to bridge that gap. Kylie.
Thank you, Gary. A $25 million hospital will be built just west of Indianapolis, dedicated solely to mental health services. Hendricks Regional Health is leasing more than a quarter of the land on its Plainfield campus to U.S. Health Vest, a national company that provides behavioral health services. Joining me now to tell us more about the Indianapolis Behavioral Hospital is Gary Everling, Vice President and Chief Strategy Officer at Hendricks Regional Health. Thank you for being here today.
Pleasure to be here.
Hendricks could have focused on anything, a cancer center or a heart hospital, but why did you choose mental health in particular?
Well, I think everybody knows the huge need with mental health, and it's a service that was desperately requested in our community. If you look at the state, the numbers are sobering and staggering. There's over 700,000 Hoosiers that struggle with mental health. Over half of those have a coexisting condition of substance abuse. You know, the numbers that are even worse are there are about 150,000 Indiana residents who have considered suicide in the last 12 months, and even more alarming is, that really touches our heart, is among the Indiana high school students. About 1 out of 5 have considered suicide in the last 12 months, and so we've got to be a part of the solution to that, and we're proud to be so.
And we'll talk a little bit more about the medical side of things, but on the business side, you said it was a hard decision to give up about a quarter of the property on your Plainfield campus, leasing it to U.S. Health Vest. Why did Hendricks choose U.S. Health Vest in particular?
Right. Well, actually, U.S. Health Vest reached out to the Indiana Hospital Association and asked, you know, if there were hospitals that they wanted to partner with. Obviously, their brand doesn't mean as much in this market. They're going to build that brand, but they wanted to be attached and partner with a hospital. And I met with their real estate folks, and you know, to make a long story short, we did a lot of due diligence on this organization. We did some background checks on the owner, on the organization. I talked to other hospital CEOs around the country that have partnered with them, and spotless reputation. I'd tell you the other thing that speaks volumes of U.S. Health Vest is that regardless of their patient's ability to pay, regardless of their age, or regardless of their condition, whether it's substance abuse or mental health, they accept everybody, and that fits really well with our mission.
And you mentioned some really huge numbers as far as Hoosiers that have a mental health condition. How does that translate into impacting the local economy for those people having someplace to go now for treatment?
Sure. Well, locally right now, people have to be transferred either to the south side of Indianapolis or on the east side of Indianapolis if they need inpatient care or intensive outpatient care. So that's significant in and of itself, just from a lifestyle standpoint and access to care. We have relationships and partnerships with over 450 employers in our market. Many of those employers provide health insurance. Most of them do. And much of that health insurance cost is related to mental health, where there's really not a really strong provider in that market that U.S. Health Vest can bring, and so that's going to be a huge impact, positive impact from a financial standpoint to those employers.
And we just have a few seconds left, but there is going to be some collaboration, even though U.S. Health Vest owns this hospital. Tell us a little bit about how you'll collaborate.
Yeah, so we've already talked to U.S. Health Vest. We met with their leadership, and they're going to work with a team to have their team in our emergency department in Danville and in Brownsburg to help with the transition of those patients. Let's get them taken care of from a medical standpoint, and then if they need mental health status, if they have a mental health status and need further care for that, then we can help that transition to that hospital. They'll also accept direct transfers from an ambulance standpoint as well. But we always, as a hospital, most hospitals receive many of those patients in their ER. So a lot of collaboration opportunity.
Well, Gary, thank you so much for being here. A very important topic.
Well, thank you.
Gary, back to you.